Hello, my name is Stephen Schenzel, and I'm Professor of Community Medicine and Healthcare at UConn School of Medicine, and I'm going to talk to you today about the role of qualitative methods in epidemiological research. Epidemiological research seeks to identify incidence, prevalence, and causal factors associated with health problems. Incidence referring to the number of new cases of dysfunction occurring in a specified population in a discrete period of time. Prevalence referring to the number of people who have a disorder at any given time, identifying causal and associated factors that contribute to or mitigate disorder and dysfunction. The emphasis on most of these approaches is numerical, that you're counting incidence, you're counting prevalence, and you're using statistical procedures to test hypotheses of the association of causal and associated factors with a particular disorder or dysfunction. The methods that epidemiologists use are primary data collection with quantitative closed-ended surveys, or extracting numerical data from medical records, or using secondary data, existing data sources that would include NHANES or AdHealth or the US Census, and a whole panoply of surveys and publicly accessible data. Again, the emphasis here is on numerical data, analyzed with parametric and non-parametric statistics. But the problem is that initiating research with this kind of numerical data suggests the possibility that you may not know enough to ask the right questions, transforming the behavior into numbers, and then testing those numbers when in fact they may not be the right questions to ask, the right issues to pursue, the formulation of the right language and terms. And just to emphasize that, for those who have been asked to design an epidemiological study of sexual behavior and sexual risk among youth 13 to 18 in Mauritius, you may find that if you ask the question, which is very common among adolescents, have you had sex? This is going to be a problem in Mauritius because in Creole, there are two sexual terms, faire met d'ambord and faire lao. These are sexual activities, for the most part heterosexual activities, and faire lao involving the rubbing of genital area with the two partners. And met d'ambord involves penetration of the penis into the vagina up to the point that the individuals think the hymen would be left intact. Neither of these behaviors are defined by youth as having sex. And so as a result, you miss a great deal of risky behavior. In the case of prevalence and causal factors of asthma, described as asthma in Spanish in the Puerto Rican community at Hartford, it was found in in-depth interviewing and analysis of classificatory systems that asthma is not a physical disease, but a mental health disease. And that classification changes the dynamic, the perceived dynamics of asthma. So knowing that is not something, since the emphasis on survey instruments is representation and not discovery, you're going to be misled if you ask the wrong questions in relationship to asthma. Determining the quantity of ethanol consumed by men who drink over the past week requires understanding what a standard drink is in Uganda. In the part of Uganda that I did my dissertation work, the major consumption of alcohol is through banana beer, developed in a dugout-like canoe, buried in the earth for a while so that the banana ferments after being crushed, drunk in a calabash or gourd. Since the gourds don't come in standard sizes, the ability to identify a standard drink is not that easy and requires a good deal of interviewing, observation to establish a way to standardize drinks in this area. Identifying the degree of perceived risk associated with IDU in shooting galleries in Hartford requires not so much interviewing, but observation. Creating safety for the researcher to do observation in shooting galleries and noticing who's sharing needles and doing follow-up interviews to seek to explain why there's sharing of needles with some individuals and not with others. What you learn is that sharing needles is more characteristic among individuals that know each other, that there's something about knowing them and having a relationship that defines them as safe to shoot with. Of course, researchers in this particular case saw many individuals who they knew were HIV positive, sharing needles with those who were not HIV positive. And finally, another example is discovering the salient sexual health concerns of men in an HIV program and discovering that men are much more interested in sexual performance than they are in terms of disease. And so the ability to link what you've learned through interviewing and discussing this with key informants that might include alternative providers provides a basis for constructing both the research and the possible intervention. So when we compare research methods, each of them has their strengths and their weaknesses, and what we're aiming for in almost all research is a mix of qualitative and quantitative methods. Qualitative methods describe the quality of the phenomena. The epidemiological or quantitative methods describes the quantity of the phenomena. So really understanding and defining carefully the nature of the phenomena is a qualitative process, whereas measuring it, its quantity, its size, is a quantitative process. Qualitative methods are primarily inductive. They build theory because you're going in to try in an unstructured way to discover, whereas quantitative methods are primarily deductive, testing deductive theory. We use, in qualitative methods, text and narrative. Observation requires describing this in words and paragraphs. Interviewing involves recording individuals, narrating their perspectives and their lives and the events in their lives, whereas quantitative generates numerical data for analysis. The unit of analysis is usually larger than the individual. Dynamics in the community, identifying sources of locations for drinking or drug use. These are community-level criteria and knowledge that you're trying to generate, whereas the analysis for surveys are primarily in terms of the individual. Using selective sampling, because random sampling, there's a feeling that and a perception that individuals share a common culture, a common set of attitudes and behaviors to some degree. So you don't need random sampling, but rather selective sampling to discover the elements you're interested in, whereas quantitative methods emphasize random sampling. Qualitative methods emphasize validity, and quantitative methods emphasize reliability and generalizability, meaning that we want both. We want to know whether the concept means something to people in the community, and we as well want to know reliability and generalizability. And finally, qualitative methods are focused on discovery, things that you're identifying in the community that you didn't know before, versus the things you do know and want to understand the distribution and frequency of those phenomena. Now, there are many methods of qualitative data collection. There isn't really time to go into all of those, but here are the primary issues. First of all, there are archival materials, not just secondary statistical data or raw data, but archival materials in the form of court records, medical, clinical narratives, and other sources, reports of events, newspaper reports. All of these are could be considered as narrative qualitative materials. Key informant interviewing involves identifying experts in the community or in the population you're focused on who have special experience, special knowledge, longevity in the group, provide services to the group, and who you can interview to find out not their specific lives, but their general understanding of the population under study. Social and geographic mapping also includes a certain level of narrative, especially social mapping, in which the method is used of getting individuals to assess and identify locations in the community for acquiring drugs or drinking or any phenomena you're particularly involved in. Social networks will be covered by my colleague, Dr. Gene Schenzel, and you'll have those components coming up in your sessions. Observation involves the ability of watching in real time individuals behave, for example, in that shooting gallery. Unstructured interviews require sitting down with people and asking a minimal set of questions about the phenomena you're interested in. Tell me more, and using probes to extend that so that you can hear language, you can hear phenomena, you can hear events that you may not know about. We'll talk about consensus modeling in a bit. So I mentioned sources of information and stimulation if you're looking at sexual behavior, historical sources, experts, records, and reports. Unstructured interviewing might include, if we were still focused on youth leaders, those who work with youth, school administrators, general community leaders, parent organizers. It's up to you to identify a relevant set of groups who you can interview. Mapping of behavioral scenes could include meetings where youth issues are being discussed and noting the dynamics of that, going to markets, to recreational settings, to work settings, to understanding the dynamics and behavior within schools. You can look at repeated behavior in terms of daily schedules, define subgroups and cliques in terms of who hangs out together, who eats lunch together in a school, and of course, behaviors associated with drinking, substance abuse, violence, and many others. I talked about in-depth unstructured interviewing, and at that, I won't go into detail about domain or factor level questions, just simply to say that you want to start with a minimal question that avoids structuring the individual's narrative in such a way that you force it into your categories and establish their categories and the discovery of the events and behaviors and attitudes that will structure your research in later stages. Semi-structured interviews are open-ended questions that are more like a survey instrument and frequently get used as the step before the development of a survey instrument when you especially don't know how to structure the questions into a closed-ended survey. Free listing and consensus modeling involve listing a series of behaviors or events or things In this case, you'll see that they're structuring sexual behaviors and aggregating them into things that are similar and disaggregating those that are different. And the first step in that is free listing. You list all the, for example, in this case, sexual behaviors. And in the next, you sort them based on their affinity or their lack of affinity to other behaviors. So let me describe, this is a particular consensus model of intimate behaviors among female youth. And one of the things you notice is that there's a set of behaviors to the left that may be seen as the initial stages of intimacy, whereas the behaviors to the right are behaviors that involve penetrative and risky sex to a great degree. And there's a very clear demarcation between these two for girls, for female youth. For boys, notice that the linking of this more serious sex to the initial intimacy involves both kissing and kissing with tongue. So the behavior of kissing and kissing with tongue to young women are seen as part of the initial intimacy and not leading to the more penetrative kind of sex. Whereas for the boys, kissing and kissing with tongue are a linking behavior to penetrative sex. And this is an important step to understand, both in establishing interventions as well as structuring survey instruments and more quantitative approaches to researching these issues. Now, one of the problems we have in qualitative data is that there are frequently situations where we can't easily audio tape or videotape, especially at a meeting, an event, a market, a march. So your jottings, quick notes to yourself that trigger memory so that you can get to the computer within a couple of 3 hours, to transform those jottings into sentences and paragraphs are vital. That's your only source of transcription. Audio tape can be useful, but remember, if you have an hour's interview, which could add up easily to 40 pages, that means you're sifting through an enormous amount of material. So some people go from jottings, even in their interviews, to create rich description that can be analyzed effectively. There's a program, many programs, in Vivo, Atlas TI, Ethnograph, that code and organize and manage and provide analysis of qualitative data. So this particular paragraph is coded multiple times because multiple issues, individuals don't stick to one issue per sentence or one issue in the paragraph. And so this paragraph could be organized, could be coded as children or economics or extended family or household characteristics, marital formation, migration, personal beliefs, and self-description, even in that short paragraph. And the programs draw these pieces out by their code and allow you to manipulate them, either have all the codes of the same issue together or begin to test qualitative hypotheses. This work leads to its own results. Description becomes an important aspect of conveying what's happening in communities and with population groups, especially in communities and population groups that are not well known. But they also can evolve into an ethnographically informed survey, in which now the items have a solid qualitative base and are validated so that you can ensure cultural and community relevance for your survey instrument. And finally, I mentioned these tools of Atlas TI or Ethnograph or NVivo or many others, consensus modeling and cognitive mapping with a program called Anthropac, still in either its DOS or beta stage, and quantitative analysis, SPSS, SAS, and SysStat, as well as many other programs these days, including R. So what we have here is a methodology for coming up with research questions, for describing a population, for discovery, that I think you'll find essential in developing an effective epidemiological research and intervention program. Thank you.